Have you ever wondered why millions of people around the world still use traditional Chinese medicine after more than 3,000 years? Imagine a medical system that views your body as a connected whole, not just separate organs, but one complete system where your mind, emotions, environment, and lifestyle all influence your health. Traditional Chinese medicine, often called TCM, is one of the world's oldest continuously practiced medical systems. Originating in ancient China over 2,000 years ago, it remains widely used today. Today, many hospitals in China combine traditional Chinese medicine with modern medicine to help patients recover from illness, manage chronic pain, and improve quality of life. But how does it work? What are yin and yang? What is qi? Why do people believe acupuncture can relieve pain? And what does modern scientific research actually say? Let's explore. What is traditional Chinese medicine? Traditional Chinese medicine is a complete healthcare system developed through thousands of years of observation. Unlike modern medicine, which often focuses on identifying specific diseases, TCM aims to restore balance throughout the body. According to TCM philosophy, health occurs when the body's systems are balanced. Disease occurs when this balance is disrupted. Treatment focuses on restoring harmony rather than simply removing symptoms. Traditional practitioners evaluate sleep, digestion, appetite, energy, emotions, breathing, skin, tongue appearance, pulse quality. These observations help determine patterns of imbalance according to traditional diagnostic methods. Yin and Yang, the balance of life. One of the most important concepts in TCM is yin and yang. Yin and yang are opposite but complementary forces. Nothing exists as completely yin or completely yang. Everything contains both. Examples include yin, rest, cooling, night, water, stillness, moisture, yang, activity, warmth, day, fire, movement, energy. Think about day and night. You cannot have one without the other. When one changes, the other changes too. The body works the same way. Examples according to TCM include too much yang may produce feeling hot, irritability, headaches, dry mouth. Too much yin may produce feeling cold, fatigue, slow digestion, low motivation. The goal is balance. It is important to note that yin and yang are philosophical concepts rather than scientifically measurable biological forces. Qi, vital energy. Another central idea in TCM is qi. Qi is traditionally described as the vital energy that flows throughout the body. According to TCM, qi powers every bodily function. It supports breathing, digestion, circulation, movement, thinking, healing. Qi is believed to travel through pathways called meridians. If qi flows smoothly, the body remains healthy. If qi becomes blocked or weak, illness may develop. Modern anatomy has not identified physical structures corresponding to meridians or qi, and these remain concepts within the traditional medical framework rather than established scientific anatomy. Acupuncture. Acupuncture is probably the best-known treatment in traditional Chinese medicine. It involves inserting extremely thin sterile needles into specific points on the body. According to TCM, the needles restore the smooth flow of qi. From a modern scientific perspective, researchers have proposed several mechanisms. Studies suggest acupuncture may stimulate nerves, trigger release of endorphins, the body's natural pain-relieving chemicals, influence pain-processing pathways in the brain and spinal cord, affect local blood flow. The strongest evidence supports acupuncture for certain chronic pain conditions, including chronic low back pain, knee osteoarthritis, and some types of headache. Evidence for many other conditions is mixed or still inconclusive. Patients should always seek treatment from trained, licensed practitioners using sterile single-use needles. Cupping therapy. Cupping uses cups placed on the skin to create gentle suction. Traditionally, practitioners believe this helps improve the flow of qi and blood. Modern researchers think the suction may increase local blood circulation, stretch connective tissue, reduce muscle tightness, temporarily alter pain perception. Many athletes have used cupping therapy. You may have noticed the circular marks left on the skin. These are usually temporary bruising caused by suction rather than burns. Scientific evidence suggests cupping may help some people with musculoskeletal pain, but more high-quality research is needed to confirm its effectiveness for many conditions. Moxibustion. Moxibustion involves burning dried mugwort, known as moxa, near specific acupuncture points. The heat is believed to warm the body's meridians and improve the flow of qi. Traditionally, it is used for feeling cold, fatigue, digestive discomfort, certain pain conditions. Some studies suggest heat stimulation may improve circulation and reduce pain, but overall scientific evidence remains limited for many uses. Care is also needed to avoid burns or smoke irritation. Ginseng, the king of Chinese herbs. Panax Ginseng has been used in Chinese medicine for over 2,000 years. Traditionally, it is believed to strengthen qi and improve vitality. Modern research has investigated whether ginseng may reduce fatigue, support immune function, improve mental performance, help regulate blood sugar in some people. Results vary, and effects are generally modest. Ginseng can interact with certain medications, including blood thinners and diabetes medicines, so people should consult a healthcare professional before using it regularly. Astragalus. Astragalus is one of the most frequently used herbs in TCM. Traditionally, it is believed to strengthen defensive qi and support resilience. Modern laboratory and early clinical research suggests astragalus contains compounds with immune-modulating and anti-inflammatory properties, but larger, well-designed human studies are still needed before firm conclusions can be made for most medical uses. Goji berries. Goji berry has long been used in Chinese medicine. Traditionally, it is associated with supporting the liver, kidneys, and vision. Nutritionally, goji berries contain vitamin C, vitamin A, fibre, iron, antioxidants, including carotenoids. Research suggests they may contribute to a healthy diet, but claims that they prevent major diseases are not supported by strong clinical evidence. Ginger. Ginger is used around the world, including in TCM. Traditionally, it is believed to warm the body and aid digestion. Modern evidence supports ginger for several uses, including helping reduce nausea related to pregnancy, motion sickness, and some chemotherapy treatments. It may also have mild anti-inflammatory effects. Modern hospitals integrating traditional Chinese medicine. Today, many hospitals across China combine TCM with conventional medical care. Patients may receive modern diagnostic imaging, blood tests, surgery when necessary, prescription medicines, acupuncture, herbal medicine, rehabilitation, Tai Chi, dietary advice. This approach is often called integrative medicine. The extent of integration varies between hospitals and countries. Outside China, some hospitals and clinics also offer acupuncture or other complementary therapies alongside conventional care, particularly for pain management and supportive care. Scientific research and evidence. Traditional Chinese medicine has attracted increasing scientific interest. Research has produced a mixed picture. Some practices have relatively strong evidence for specific uses. Examples include acupuncture for certain chronic pain conditions, ginger for nausea, some herbal medicines for carefully studied indications. Other therapies remain uncertain because studies are small, inconsistent, or of variable quality. Researchers continue to investigate herbal compounds, anti-inflammatory effects, immune regulation, brain responses to acupuncture, chronic pain management. One important point is that natural does not always mean safe. Herbal medicines can interact with prescription drugs or cause side effects, so they should be used under the guidance of qualified healthcare professionals. Traditional Chinese medicine has survived for thousands of years because it represents a rich medical tradition built on centuries of observation and experience. Some of its practices have gained support from modern research for specific conditions, while others still require stronger scientific evidence. Today, many people choose an integrative approach, using evidence-based conventional medicine alongside selected complementary therapies when appropriate and under professional guidance. Understanding both the history and the science helps us appreciate how ancient knowledge and modern medicine can sometimes work together while recognizing the limits of current evidence. If you enjoyed learning about traditional Chinese medicine, subscribe to Ancient Healing for more evidence-informed explorations of healing traditions from around the world.